Welcome today. I'd like to begin by acknowledging the traditional owners of the land on which we're meeting. I'm on the Wurundjeri land of the Kulin Nation. I'd like to acknowledge elders past and present, emerging Aboriginal leadership, Aboriginal people with us today, leaders from other cultures, and that this is and always will be Aboriginal land. Today's webinar is part of the Tri-Peaks series, which is a collaboration between the Centre for Excellence in Child and Family Welfare, the Victorian Healthcare Association, and the Victorian Alcohol and Drug Association, or VADA, to support integrated practice and good governance across our three sectors. I'd like to acknowledge my fellow CEOs, Tom and Sam. This is a Zoom webinar, so please use the chat and Q&A functions for your questions and comments. At the end, if we have time, we'll also have a Q&A session. As the pandemic continues to impact Australian workforces, more organisations and leaders are seeking evidence-based solutions to manage psychological hazards such as occupational violence, fatigue and stress. And this morning, many of my colleagues who texted me and some online this morning wasn't sure that today would happen given the tremor here in Melbourne. I'm sure that many of you who were inside could feel that this morning. I think a seismic level 6 earthquake here in Melbourne. But while health and wellbeing can at times seem to be catch-cries for individual responsibility, there is a need to manage these issues systematically as part of a business as usual. Indeed, one of the key recommendations of the Royal Commission into Victoria's mental health system calls for the Victorian Government to foster the commitment of employees to create mentally healthy workplaces, advise on and develop and provide resources to assist employers and employees across Victorian businesses to promote good mental health in workplaces, address workplace barriers to good mental health, promote inclusive workplaces that are free from stigma and discrimination, and support people experiencing mental illness at work. This finding is supported by last year's Productivity Commission inquiry into mental health, which recommended prioritising reforms that equip workplaces to be mentally healthy. This webinar seeks to provide practical prevention and intervention strategies for health and wellbeing among our community services. Presented by Richard Kasperczyk on behalf of WorkSafe Victoria, this session will explore the systems and impact on mental health and wellbeing and key topics, including mental health and wellbeing in the workplace, including roles and responsibilities, a systematic approach to prevention and discussion of work-related factors, and how to promote positive mental health and wellbeing and prevent mental injury. I'm going to get you to start thinking about your questions and putting them in the chat. I've got one here for you. Let me start with a question. What is something you have in your workplace that you feel supports health and wellbeing? Start popping those things in the chat. But first of all, I'm now first and foremost going to introduce Richard to you. Richard is an organisational psychologist with over 25 years of experience of consulting and training with a focus on mental health and wellbeing in the workplace. His passion for healthy and high-performing organisations led to the earliest application of a risk management framework to managing psychological health and safety in Australia. A valued member of the WorkSafe Organisational Psychologist Panel, Richard provides subject matter expertise to support the prevention of mental injury in Victorian workplaces. Until recently, Richard was Managing Director of one of the largest employee assistance programs and providers in Australia, a Fellow of the Australian Psychological Society and a former National Chair of its Private Practice Division. Richard has written books on managing psychological practices in Australia and the UK. Richard lectures in the Masters of Organisational Psychology course at Deakin University in Leadership Development and Occupational Health and Wellbeing. He delivers training and coaching services to many organisations in the public, healthcare and community services sectors, including the Department of Health and Human Services, Victoria Police and the Department of Education. He also advises WorkSafe Victoria on workplace mental health. And I'm delighted to introduce Richard. He is really looking forward to today and has put together a fantastic presentation, and I hope that you enjoy. Thank you, Richard.
Thank you very much, Deborah. Thank you to all of you for joining me to reflect on this very important subject. I would also like to acknowledge the traditional owners of the land where I'm coming from, and at the moment I'm on the lands of Boonwurrung people of the Kulin Nation on the Mornington Peninsula. Thank you also to WorkSafe and the Centre of Excellence that made this webinar possible. I hope that we'll be able to interact a little bit using your chat and Q&A function in any of these presentations. I really wish I could see all your faces and interact with you directly, but please remember that you will receive the handout with all the slides that you'll be seeing here, and it will have some resources as well that will be included in there. I also hope that we'll have at least a quarter of an hour or so to spend some time on question and answer session as well. And I also hope that you're all safe after the little tremor, as Deborah has mentioned. It was a little bit more than a tremor for some of you, perhaps from north east Victoria, near Mansfield. And who would have thought that at on this very day we'll be reminded of our vulnerability and one more reason to leave home, and that is to avoid the earthquake. But I hope that you're all safe. So here's the agenda that I have for today. I'm hoping to initially just introduce the sort of general aspects of mental health to remind us of what we're talking about. We'll talk about legal foundations, roles, responsibilities, then strategies, particularly focusing on prevention. Some of the workplace factors we'll be addressing, and then focusing on addressing mental issues as they arise, promoting positive mental health and wellbeing, and finishing off with self-care tips and some time for Q&A, as I mentioned. So let's start by just generally reminding ourselves about what mental health is about. I know most of you are experts in this field, and you work in probably mental health with your clients all the time. Just a couple of reminders, though, for all of us, because no matter how much we know about it theoretically, it's always useful to remind us that it applies to every one of us on every day. So here's a couple of comments that I have picked up from the Productivity Commission Mental Health Inquiry report that was delivered last year. We've had a number of the inquiries, and here's a kind of a nice summary which nicely paraphrases the frequently used definition of the WHO, the World Health Organization. So here's a reminder that mental health is important to everyone at all times, everywhere, which includes our work. Now, we often hear, of course, now that during this pandemic experience, mental health is important, especially now, but it's always been important, right? And we know there's no health kind of without mental health. So just a first question for you to ponder straight away as we begin. If it's really important to you personally, to you in your organizations, in your teams, wherever you are, then is it strategically prioritized in your organization and in your teams? And by that, I mean, is there a strategy for our mental health, just as there are other strategies and action plans for other business, kind of as usual organizational priorities? And at your personal level as well, do you prioritize it in your actions every day that protect your own mental well-being? The next point is that it means different things to different people. So it's a good reminder that every experience is individual, and including our reactions to the pandemic and in fact, the earthquake situation, everyone had a different reaction, I'm sure. And here's a useful reminder and a checklist for all of us as to what actually mental health means to us, and that is to have enjoyment in life, being resilient in response to various stressors, fulfilling our goals, developing our potential, building relationships that are meaningful, and participating fruitfully in the community. And another quick reminder that, of course, mental health exists on a continuum. So from positive, healthy functioning at one end, the green end here, through to severe symptoms of mental health conditions at the other red end. And of course, in the sort of yellow-orange area, people may start moving sometimes into places where they have difficulty coping with some symptoms increasing in severity perhaps, and then hopefully bouncing back to the green end. So we move forward and back along this continuum all the time, all of us, depending on what particular factors happen in our life, in our circumstances. And we know some of the symptoms that we all are aware of are, perhaps disturbed sleep or social withdrawal, feeling overwhelmed. And it's not a one-way sort of movement, is it? It's we can naturally kind of feel not as healthy one moment and then recover and bounce back. In fact, I think perhaps a better analogy might be sort of sitting on a medicine ball and kind of constantly balancing ourselves. Sometimes, needing to relax and engage in some sort of energizing activities to bounce back. Every one of us, I'm sure, feels that same experience. So various factors influence our mental health and can nudge us kind of back and forth. And whereas in the past we have been focusing on some of the individual factors more, and therefore focusing on resilience and coping skills, we really now know that prevention needs to be focused on our social environment, on our society and systems that we are engaged in. So particularly our work environment that we'd like to focus on today, and our work system plays a big part in either creating that sort of risk that nudges us towards positive mental health outcomes, risk that nudges us towards poor outcomes, or positively protecting mental health and helping us to stay or become well. So a mentally healthy workplace that I'd like to focus on today makes that big difference in shifting us towards the green zone. And mental health, by the way, when we talk about this, let's be upfront, it is good mental health, right? So I'm not going to be sort of using the words like and well-being at the end of mental health, because mental health is not the absence of ill health. At times we hear people using that phrase as if it somehow indicated ill health, but it is positive mental health. In fact, mental health is defined in terms of a state of well-being, so in terms of well-being. So I also am not going to go backwards and forwards and talk about psychological health or emotional health or cognitive health or social health. I'll just talk about mental health that covers all of those terms interchangeably. Now, the good news is that mental disorders that we know are usually associated with abnormal thoughts, emotions, behavior, and relationships with others. They can be successfully treated most of the time with enough support and seeking help. That is vital. Now, speaking of seeking help, if there is anything at all that I might mention or throughout this webinar that you find you might need support for, so please don't hesitate to seek help by, for example, reaching out to Lifeline on 131114. Now, we also know that the best approach to mental health is to focus on prevention and to engage in as many protective factors as possible. Now, let's think a little bit more about a pandemic that has been so impactful on all of us. And we need to acknowledge some of the things that we are all experiencing. So generally in our community, you probably find that some of these, I'm sure you might be sharing some of these even on chat if you wanted to, about the sorts of impacts that we've experienced, particularly loss of autonomy. We all need our autonomy, our control of our lives to feel safe and feel like we're achieving things in life. And that is one of the things that has impacted on us. There's an anxiety, of course, fear, uncertainty, and it is quite normal at times like this to therefore be feeling overwhelmed and stressed, to even perhaps have some conflicts because of it, unfocused. I'm not sure if you've come across this word popping up often these days. Languishing is one of the things that we hear. That is sort of a sense of not being motivated, not being focused. And they are quite normal reactions to the situation we are finding ourselves in. And then at the same time, we find that in fact, there are some positive outcomes from the situation we're finding ourselves in. So this fact that we are feeling overwhelmed at times does not mean that it leads to symptoms of ill health. There are some new demands that we are finding. We can achieve new skills and we've got more flexible work options. Moving to the same question of how does COVID impact us in our workplace, we can think of the sorts of challenges that we're finding, for example, in connecting with our clients. We're finding that our routines have changed, that we have to juggle personal and work demands. We've got uncertainty about our roles, and therefore it's not surprising that we are feeling also exhausted, perhaps frustrated, and sometimes forget about our self-care. So that is part of our normal experience of the pandemic, which, you know, our predecessors 100 years ago probably experienced in a different way. So it's one way to remind ourselves that perhaps when we say that it's unprecedented, it actually in humanity is not unprecedented. Just to change the way we think and help us process this and stay healthy. So while we are experiencing all of these sorts of potential risks in our life, we can also remind ourselves that at the same time, despite all of these amazing demands that our work demands of us, that we have this dedication and commitment to our clients that, from what I hear, what I see out there, has not changed. It's unwavering. We have adapted. There is resilience out there. We've used the technology to the best possible extent, and therefore we potentially have actually new future options for our clients that could be making it more flexible, more have greater ability to connect with them in the future. So how does mental health and work impact on each other? Well, generally speaking, we know that work is a protective factor for our mental health. And of course, in brackets there, I have under the right conditions, because some of you must be thinking, yes, but some of the work could be toxic, and that's true. But when work is positive, when it's uplifting, when the work conditions are right, there is a tremendously positive impact on our health. So it is bi-directional, by the way. That impact is important to remember, that they go hand in hand, mental health and work. So therefore, we need to be mentally healthy to do our job well. And our work can boost our mental health and nudge us towards that well-being zone at the green end that I was referring to. So good working conditions help protect our mental health. And I'm not going to focus on this too much, but it's, let's say it's given that there are huge benefits for organizations when they prioritize mental health. Whether it's economic, as we have here on the screen there, that's reminded that there is a good return on investment when we focus on mental health, but also generally client outcomes are better. People want to come to work in places that are known to be mentally healthy. So what are some of our roles and responsibilities in terms of mental health? I've got this sort of diagram just slightly changing that continuum of unwell and being well and recovering. If you think of it as a kind of cylinder that wraps around well, and both of these ends of this zone, at all times, prevention and promotion are valid and reasonable responsibilities to engage in. So wherever we are, whether we are in leadership positions or in any situation, promotion and prevention is where we'd like to be involved in. And at times we need to be involved in, of course, intervening early when there are some signs of ill health, when people are away from work, perhaps being treated, we need to support them in recovery. So it is a shared responsibility on all of us, right? Not just leaders, but leaders have a special responsibility to create the sort of work systems and culture that supports our mental health and protects our mental health. One of the things that I just want to point out is that it is not our role in the workplace to either diagnose people. So even though we might have great knowledge of some of the conditions, it is not our role to diagnose team members. And it is not our role to counsel or treat them, that they really need to focus on helping them towards seeking help and encouraging and supporting them to do that. So that's a kind of a summary of our responsibilities. And very briefly, I wanted to remind us of our legal foundations for prioritizing mental health in the workplace. It is not just because we feel like it's a good idea to do one day and not the other. There are very important fundamental legal foundations that support that the new conversations and movement towards creating mentally healthy workplaces. So health is, of course, includes psychological health under the Health and Safety Act in Victoria, 2004 Act we're talking about. So this act requires us to provide and maintain a working environment that is safe and without risks to psychological health. We are required to, of course, to consult with our employees, and that's significant for some of the prevention activities that I'd like to focus on in a minute. And whenever we, sorry, shifted the slide a little bit too fast. So whenever we get involved in trying to create our risk management approaches and consult with staff, there is actually a fundamental legal responsibility for us to do so. And everyone has duty of care to take reasonable care for themselves and for others. So it's kind of a reminder that we all have a responsibility to not ignore when there are some issues that are happening that perhaps impact our mental health negatively. Other legal foundations I'd like to just point to are avoiding discrimination, so the Discrimination Disability Acts, Equal Opportunity Acts, both state and federal acts are relevant to this topic. They require that, of course, we do not discriminate against people or harass workers with mental illness. And there is positive duty also to take measures to prevent discrimination for mental illness as well. Returning to work, there is, of course, legislation relating to Workplace Injury Rehabilitation and Compensation Act, and the same laws apply to returning people with any injury as with mental injury. And a couple of others, ensuring privacy is significant. We need to remember to keep the information about others' mental health private, and also to avoid adverse action. Fair work is also relevant in this discussion. So if you have a discussion about how to create a mentally healthy workplace, some of the legal foundations are listed here for you. So if we have a discussion about what actually is a mentally healthy workplace, I'm sure that some of you will have intuitively kind of good ideas immediately, and you might start sharing some of them. It would be great if you could do that, so that we've got a list of them later on as to what you would imagine a mentally healthy workplace is. So you might say that it's a place where you feel respected, that you feel valued, you feel safe, engaged, energized at work. But I'd like to start initially with a kind of overarching assumption that we have to have a shared vision in our organization, in our teams, to positive mental health, a kind of commitment that throughout the whole organization that mental health is to be prioritized, that it is important. It's also, and this is not an exhaustive list, of course, of features and hallmarks of a healthy workplace, a mentally healthy workplace, but it is certainly a place that prioritizes systematic identification of risks to our mental health. So there are prevention systems in place, not just ad hoc, but systemically. It's a place, it's only one aspect of work conditions here that I've picked, and that is work demands that are so important for us. And that means that it's a place where there are work demands that are realistic in such a way that there are needs of both staff and the organization balanced, so that there is no unreasonable risks to mental health. It's a place where there is freedom to speak. There's kind of a sense of being able to talk about my mental health without fear or stigma or discrimination. It actually is even broader than that. It's a place where there is kind of psychological safety to speak up about any issues, seeking support, for example, asking questions. That's the sort of important part of what a mentally healthy workplace is. There is therefore a place of respect, fairness, inclusivity in our culture, and there are good systems of support for mental health. So this is a big list, and it is one that has been talked about many times by WHO, that actually involves a continual improvement to protect and promote the health and safety and well-being of all workers and sustainability in the workplace. That's the official kind of definition of what a healthy workplace is, which includes mentally healthy workplace. But in summary, there are three aspects to it. So there are three aspects that we kind of have been referring to as an integrated approach. So there are three pillars if you've got a checklist that you kind of have as broad as possible a checklist to see if your organization is a mentally healthy workplace, then you would want to look at those three big ticket items. One is, do we prevent work-related harm to mental health? Secondly, do we promote the positive aspects of work? And there are kind of two aspects to it. One is creating a positive kind of culture or work systems, but also to create an environment where mental health is talked about openly. There's greater awareness of it. So that's promoting the positive aspects. And thirdly, do we address ill health? That is, do we ensure that people who experience mental health concerns or difficulties are supported? So they're the three overarching aspects of mentally healthy workplace that I'd like to focus on one by one, and starting with prevention. So you might have seen this sort of diagram that has been used in the Victorian government workplaces. That has got three aspects to it. The blue segment talks about protecting from mental injury and illness. So this is the prevention part, preventing harm. And before we even are able to do that, there are three kind of underpinning principles that are needed to get this strategic approach to mental healthy workplace happening, and that is leadership commitment. We do need to talk about that. It is a leadership commitment to mental health being a strategic priority, on par with two things. One is physical health and safety of our staff, and on par with client outcomes. That is my big question that I keep repeating. Is it a strategic priority that realizes and acknowledges that we cannot have great client outcomes without a mental health priority of our staff? It's a leadership commitment to systematic identification of hazards and actually creating action plans, making decisions to reduce risks in consultation with staff. Do we have a leadership commitment for that? And if leaders are also committed to doing it systematically and ongoingly, then we do need to have ongoing meaningful participation of our staff. We cannot just decide what the mental health risks are without talking to people. Starting a conversation, however small, however big this may be in your organization, but we do need to have these three underpinning principles before we are able to systematically protect our workplaces from harm. Then moving on to the yellow segment, that's the positive part I mentioned before, promoting the positive aspects, creating supportive and inclusive workplaces, intentionally creating positive kind of organizational climate, focusing on strengths, modeling positive leadership behaviors, supportive leadership behaviors. All of that is covered under that yellow zone. And there's an overlap, by the way, between the blue and the yellow zone. You might immediately identify that really good work systems typically involve positive aspects of work, and good work systems are preventing risks to our mental health. The third pink segment focuses on addressing issues as they arise. So addressing ill health, irrespective of cause. And here's an important part, not just mental injuries that perhaps are associated with workers' compensation claims, but supporting employees with any mental health condition. Taking reports of mental concerns seriously. That's what's covered under this part of the strategy. Creating early intervention systems and helping them in recovery, and supporting them in accessing, of course, treatment, counselling, and support in general. So integrated approach implies that it's not a separate function just focusing on mental health and well-being, but it's integrated with other organisational strategies and various parts of the organisation working. So at least work health and safety, quality systems, and so on. So let's focus on prevention now, very specifically. And whenever we talk about focusing on prevention, that is systematic and primary, so where we can prevent risks at the source of where they occur, of course, we need to talk about the risk management process, because it is the one process that is evidence-based, and we know it works. And it works for physical health just as much as it can work for mental health or psychological health. So here's the kind of typical 4-step risk management process that we are engaged in. And before we start, though, I'd like to identify sort of 3 areas that that need to be, or functions, activities that need to be kind of checked to make sure that risk management process actually works on a systematic basis. Now, I know there are these are 3 simple ticks here on a slide, but behind it, there is a lot of activity that needs to happen. And it could be as simple as just starting the conversation, if you're doing it for the first time, starting with the business case perhaps, or building a coalition of support with management commitment that we're going to get some resources here. We're going to be serious about dealing with a mental health prevention in our workplace. So this will require some sort of recognition that we might need different consultation strategies in different workplaces, that we need support for some of those committees that might be working on identifying the risks. We need to support them, we need to resource them. Now, if that happens on an ongoing basis, just like you would for physical health prevention, it will be happening on an ongoing basis. It will be happening regularly, and it will be just part of business as usual. So then, in our process will continue happening, whether it's on a 6-monthly basis, whether it's on a 12-monthly basis, and it will certainly pick up some of those things that are currently happening with specific COVID sources of risk, because we are doing it on a systematic basis, intentionally looking for the sources of risk. So identifying psychosocial hazards means that we are doing at least 2 things. One is looking for some data. So we analyze some available data, whether it's sick leave, work cover claims, especially mental injury claims, incidents that we have found, grievances, experiences of trauma, any reports from your workplaces, from your team members who are saying this is an issue for us, this causes some risk to our mental health. There are surveys, but there are great resources, by the way, for some of the surveys that we could be using here as well. I'll mention that later on, but WorkWell Toolkit has a WorkWell Wellbeing Insight Survey that specifically could be used for that sort of purpose. And so we've got some data that is workplace-based, and it's contextualized to each workplace for that identification of hazards to be meaningful. And apart from that, we also are looking at a systematic checklist of hazards. So yes, we're looking at some of the data that specifically comes up through looking at what happens in the workplace, but to be sure we don't miss anything, there are systematic checklists of hazards that we'll be talking about in a minute. Risk assessment is the next step. Once we have identified some of the hazards that are relevant to our workplaces. Now, this risk assessment process, by the way, doesn't need to be perfect. It doesn't need to be a huge kind of issue, very specifically and very precisely identifying extreme risk, that's different perhaps from high risk. I think we need to recognize that in this space of mental health and well-being, we need to just make sure we get it done and work out which ones are to be prioritized. So which hazards, we can't do everything at once, but if we were to focus on 3, 5 maximum, what would the highest priority risks be? So it's important to get this process done, but not sort of get bogged down in the detail of specific kind of assessment levels of risks, as you might perhaps for some of the other physical hazards. Controlling risks is the next most important step. Now that we know which ones we're going to prioritize, we need to brainstorm with consultation, of course, with staff who know best what works, what doesn't work. We need to decide what sort of controls we can put in place to make sure they're effectively reducing risks to each of them. So we take action, and once we've taken the action, we need to revise that action, check whether or not it was effective, whether it actually reduced the risk. And as you probably already have in physical health, sort of health and safety system. And it's important now to integrate it with our mental health strategy and with our business strategic plans. Now, when we talk about the hazards in the workplace and how mental injury claims are being prevented, here's a typical sort of pathway. Let's remind ourselves as to what it is that actually we are trying to prevent. When we are talking about prevention, we are essentially reducing the risks of mental injury happening. And mental injury happens when there are some negative experiences in our workplace, when there is a stress response to our work demands exceeding our resources, right? Where the ability to cope with them is exceeded. So work-related stress, when prolonged and when severe, it can cause mental harm and physical injury as well. So to prevent it effectively, we need to focus on the source of risk. So we're talking about going upstream over here where there are hazards identified that potentially have risks of injury, which then potentially might lead to mental injury. So that's why when we talk about psychosocial hazards or work-related factors, we're talking about going upstream and preventing mental injury at the source. So let's now focus on what work-related factors actually are. That sort of checklist that I mentioned before, a specific checklist of 11. I wonder, Ollie, if you can help me with putting a video on now that sort of summarizes what these might be.
We know work is a big part of our daily lives and can help promote our mental health by giving us a feeling of purpose and a sense of contribution. There's a clear link between our experience in the workplace and our mental health. Thriving at work can have a profoundly positive impact on how a person feels. Under the Victorian Occupational Health and Safety Act 2004, employers must provide and maintain a working environment that is safe and without risks to health. This includes psychological health. But what is a mentally healthy workplace? Firstly, it's one which has measures in place to prevent harm by identifying risks to mental health. It manages harm from an early stage and supports team members' recovery along the way. So, if a person's mental health is connected to their work, how are your workplace systems and practices affecting your team? There are a number of work-related factors which can be controlled and managed by employers to create a mentally healthy workplace and to prevent mental injuries. Work-related factors that are not controlled and managed can increase stress. This can lead to physical injury, mental injury, or even both at the same time. Of course, workers can be exposed to more than one work-related factor at a time. Some may always be present, while others occur occasionally. Common work-related factors that can become hazards if not managed are low job control, high and low job demands, poor support, poor organisational change management, poor organisational justice, low recognition and reward, low role clarity, poor workplace relationships, poor environmental conditions, remote and isolated work, and violent or traumatic events. Here's a few examples. Employees need challenging tasks to maintain their motivation and to develop new skills, but they also need to be able to cope. Let's call these job demands. They can have a significant impact for your team. If job demands are high, think about the support employees need from supervisors and their work colleagues. And think about the level of control the employee has in their job to meet demands. Poor workplace relationships can negatively affect the way an employee feels at work. When groups of people work together, it is likely some conflict will arise from time to time. So it's important that a workplace takes proactive steps towards preventing and managing conflict by developing a culture that promotes appropriate workplace behaviour and respectful relationships. It's important to consider the environmental conditions in your workplace and the impact on how someone can feel. Air quality, noise and temperature can increase the risk of stress to an employee. An employee may not identify and report these factors immediately, but over time they can impact on their mental health and contribute to a mental injury. Good work design enables employees to be engaged in work that is healthy, safe and productive. Consulting with employees on matters that affect their mental health at work is the first and most important step. Bring your team along for the journey. As an employer, you have the power to create a positive, supportive and inclusive workplace and to develop good systems of work for supporting mental health. Discover more about the work-related factors at www.worksafe.vic.gov.au.
Okay, so if you haven't been able to listen to this fully or hear properly, there is a link in WorkWell Toolkit that you'll be able to see. You'll be able to press on the button on the handout that you'll have, and you'll be able to listen to it again. But fundamentally, this list includes 11 generic kind of 11 psychosocial hazards that we know we need to tick off. We need to go through and double check that that in our workplaces we do have some sort of way of checking whether they are relevant to our workplace, what specifically they mean to our workplace. And then, of course, we need to control those risks one by one to be sure that we are able to reduce their risks. Now, if we follow these sorts of hazards, checklists, we'll be able to see that for any situation, including our COVID situation right now, as you can see, this is just a very simple list of under some of these work-related factors. I have thought about the different ways in which COVID-19 would impact us. So obviously working from home is related to work in remote and isolated workplaces. We could have work and home life balance out of whack a little bit. We could have job demands that are creating additional demands, additional changes in demands because there are fewer available staff to do the work. We need to be perhaps reallocated to roles that we are not familiar with. So what do we do about that? There's support issues, of course, change management issues as we change the process and so on. And you can see now this is just a generic kind of list, but in your workplace, if you do it in a systematic way, you will be finding specific hazards that are related to. So just to be sure, work-related factors are kind of general factors of work systems, and they work well. They are protective factors then. They are helping us create, great experiences that improve our mental health. But when they are broken or they're not working, they become psychosocial hazards. So that's why we've got the references to poor organizational change management and poor support as opposed to just general support, which is a general sort of work factor. Now, when we get to the risk control measures, the important thing to remember is that there is a risk hierarchy that helps us remind us what works best. What is the best way, most effective way to control the risks? And that is to eliminate them, to eliminate the hazards that pose risks. Ideally, we'd want to eliminate certain parts of our work that perhaps redesigning our jobs that perhaps we can do in order to, well, now that we are aware of what the hazards are. But in a lot of cases, we find that perhaps they are inherent in the job. We cannot eliminate all the risks. So we focus on that middle part that we can alter systems, perhaps create a different workplace layout. So for example, for some of the aggression and violence hazards, we might put physical barriers in place and change environments or provide us with different tools and so on. But consider them together as different ways of reducing the risks that is still a lot more reliable, a lot more effective than just focusing on, for example, training on how to cope with the problems that we have. Now, that is administrative controls deal with individuals complying with those directions. So training to respond to certain situations. Now, sure, at some point, that's what we might need to do, but that is not the place to go to when we look for effective risk controls. So what I'm going to do now is take one of each of these risks and hazards at a time, and we'll see how much time we have. I'm hoping to spend a few minutes on each one of them. There are a few examples, but please understand that what I've got on the screen here is just examples of some of the strategies, and there are plenty of resources there, and plenty of discussion needs to take place within the workplace to be sure that it's relevant to the workplace about what sort of controls could be useful going down that risk hierarchy pyramid. So start with occupational violence and aggression. It is just to remind us, exposure to any incident in which a person is abused. It could be a client sort of behavior, it could be verbal, physical, it could, but most importantly, it could be either psychological, mental injury related, or it could be a risk to physical injuries, not just physical injuries. And it could be perpetrated by clients. We refer to it as sort of type 2 violence, as you probably know, who are the source of the violence here is by clients or their advocates. Now, it is such an important and prevalent issue for healthcare and social assistance industry. And it's important to talk about it on a regular basis. To what extent are we experiencing the sort of cultures in the workplace that sort of tolerate this as part of doing the job? So I have put up the first control, sample the risk control here for you to intentionally work against it, against that kind of idea that it's part of the job and therefore let's not report it. It's the opposite that needs to happen. Our aggression prevention culture is one of the most important and most effective ways to reduce these sorts of hazards. Now, I know that sometimes the need for healthcare staff to protect themselves from injury in this sort of situation runs counter to their commitment to caring for their patients or their clients. So that's why it's such an important thing to deal with it systemically as an organization, to say, no, in this organization, we will not be trivializing it as something that is just to be tolerated. So a lot of discussion needs to take place, as you can imagine. I'm hoping that you'll start conversations or have ongoing conversations so that we've got clear actions that are relating to such hazards. Now, a systemic approach to incident investigation perhaps needs to happen. Make sure that every incident is seriously taken, and there are contributory factors that are being looked at, causative factors. There are some specific examples of committees that have been set up, and I've heard about some working at a sort of larger organization basis or at any level, where there is an oversight of violence and aggression strategy given as a activity, as an important part of the agenda and remit of such a committee, to provide resources, to develop training programs, to source different training programs. And of course, it could be part of the design changes, kind of the building and workplace layout changes that we mentioned before. So there are some of the risk controls, but as you can imagine, every time I'm talking about any one of these hazards, it means that there is they have been created by a consultation participation process that is meaningful to your workplace. Let's jump to the next one. Work-related specific kind of violence that includes sexual harassment. So that's any behavior that's directed at any person that affects that person because of their sex, gender, sexual orientation, or because they don't adhere to some social prescribed roles, gender roles. So that is a very kind of specific harassment and aggression that might include stalking or verbal abuse, sexually explicit gestures, offensive language, being undermined in your role, your position because of your gender, and so on. So some of the ideas here for sample risk controls is to focus on creating, again, a culture of civility. Respect in the workplace is the key here. And it's not just in one place, but across the whole organization. Creating an environment where people feel confident to report it, and that is some confidential reporting system. We now realize that bystander intervention is quite an effective sort of strategy, but the people need to be trained in how to intervene, when and how to intervene, rather than just assume that they'll simply intervene because they are wanting to, because they're bystanders. We could address unwanted and offensive behavior early with clear response to reports that do not disadvantage further harm or place blame on the reporters. Such an important part of the whole process to make sure that the system works and protects those who are reporting. Let's pick another one, support. If this hazard therefore becomes poor support, that not just sort of emotional support that we might be thinking of, but practical support from supervisors and colleagues. That is information on how to do my job, tools and equipment I need to do my job. Can I speak up and ask for it without any repercussion or fear of negative experiences? So some of the sample controls perhaps could be reorganizing our team structures to clarify lines of support. Who do I go to? Are you clear who I can go to for support, rather than just assume that I should know what the organizational structure is, particularly if it's a matrix organization and a complex organization? Do we have perhaps planned sessions to discuss needs of support? That could happen in our team meetings on a regular basis. We could problem solve freely without fear of sanctions. That's so important that we have this freedom to speak up. Training, skill training, induction, refresher sessions, all of those could provide us with a culture of support, building the culture of support. Planning, one of the important things, of course, is to be backfilled when people are absent. Just simple support of filling in for my job when I'm overwhelmed. There is a very prevalent exposure to traumatic events in our industry. Now, trauma, let's remind ourselves, can be direct, vicarious, or cumulative. Helping others cope with traumatic events, witnessing fatalities, and so on, could be a trauma-inducing experience. So some of the tailored approaches are now, we know, are effective. So including psychological first aid approaches, which of course requires certain training, being proactive in that, maintaining peer support programs, perhaps rotating roles, activities to minimize the exposure to some of the distressing events, becoming a trauma-informed organization, and much bigger sort of strategy. But as you can see, these are just samples of controls. Low, high and low job demands, such a constant issue that we hear, that there is kind of unreasonable, perhaps, expectation to do double shifts, and despite the fact that you might be exhausted. So looking at our shift work, making sure our jobs are designed in such a way that considers specific working conditions for each workplace, reviewing those workloads on a regular basis, not assuming that just because they were there, you know, pre-pandemic or middle of pandemic, that they will be ongoing and it will be okay. Again, requiring some consultation and participation of staff in creating these. Having systems in place to support employees when they have to make difficult decisions or challenging situations. What are our systems of work? For remote and isolated work, especially these days when we work from home so much, do we have access to resources and communications and help from others when we find some difficulties? So conducting and reporting regular risk assessments rather than assuming that everyone's workplace at home or in a situation at home is going to be safe. Do we have a buddy system, perhaps? Some of these things are very practical suggestions that have come from various consultations in the workplace. And just moving through to now, I think it was the pink strategy in that circle that you remember, addressing mental health concerns. Do we have sufficient awareness in the workplace and permission in the workplace, in our culture, to, when we notice some changes in the behavior, in some of the appearance, conversations, we call it kind of the ABC of mental health in the workplace, when we see some of those changes compared to before and compared over time, we're assuming that we know our team members, do we have permission to approach them, to initiate a supportive conversation? So addressing not just by leaders, but addressing each other's concerns by other team members. So noticing some of the symptoms that might include, you know, becoming restless, tense, avoiding certain activities, not turning up to staff meetings, perhaps, finding it hard to make decisions. We can see some of these things in others. And so one of the most common and structures for this sort of conversation that requires awareness sessions, requires some training, is an Are You OK resource. And that is, you can see it here, asking, preparing and approaching appropriately the person, listening with an open mind, not judgmentally as to what their needs might be, what their concerns might be, what their situation might be, exploring options, support options, encouraging them to seek help, and then checking in, making time to follow up, making sure that we have ongoing conversations of support. When we talk about addressing issues, of course, sometimes it means that people are off work because of their mental ill health. So returning to work is typically supported by proper programs and policies that are working for physical health injuries. Now, in mental injuries, it's even more important to support people and induct them back into work appropriately. So just a reminder here, there's lots of resources about returning to people after mental injury, but supporting environment that welcomes people back, that the return to work policies and processes are specially followed when we provide support when they're away. We provide appropriate contact during their time away. And particularly if there are some issues that have been identified as work-related factors that led to this injury, making sure that they're controlled before we expect the person to come back to work. Perhaps conducting work assessment and certainly involving the employee in planning their return to work, having a clear return to work plan. So all of these suggestions here apply to all of the return to work policies and processes, but particularly I think it's important to make sure we don't miss them for those who are returning to work after mental injury. Moving on to the blue part of our sector, of our segment there that I've referred to previously, promoting positive mental health is part of that two-pronged approach. On one hand, we're creating positive workplace conditions, a sort of culture that is conducive to mental health, conducive essentially to human beings, because every human being deserves to be well in their workplace, because we know that those experiences will buffer against the negative effects of stress. That could be having a strategy to ongoingly raise awareness, having meetings, agendas in our team meetings that regularly refer to checking in how we're doing in terms of mental health, making sure that that stigma is not existing in our workplace, and making sure that our workplaces, of course, have got civility and respect. So positive mental health could be, there are, I'm sure, a plethora of suggestions that you might have. Starting at the top, I've got here transformational and supportive leadership skills, because when you go to the cause of causes of all mentally healthy workplaces, we find that having the leadership commitment and supportive leadership, that is one of the most important aspects that leads to lots of other positive things as well. So making sure that our leaders are providing us with constructive feedback, that they're giving us feedback on an ongoing basis on how we're doing, that they are supporting us, they are encouraging us, that they are appreciative, simple appreciation sometimes of well done after our work has a buffering effect for our mental health when we come back to our family life again. And we feel so much better when we know that we've been validated, we have been appreciated, we've been welcomed in our workplace, we've been respected in our workplace. Now, if you haven't come across PERMA and 5 ways of well-being, I'm going to give you a quick list of what they are. There's a focus on meaning, perhaps, and social value of caring in our workplaces. Encouraging mindfulness is one of the most evidence-based actions at the moment that is linked to mental fitness, and promoting positive conflict resolution, promoting healthy lifestyles. So some of the self-care tips, by the way, particularly in these COVID-related times, it's always a reminder that wherever we are in our leadership positions or in any role, we need to make sure we are okay ourselves first. So we need to put our oxygen mask first on ourselves. One of the ways to keep reminding ourselves is to keep the whole situation in perspective. that it's not going to be there forever, and so on. Balancing consumption of news, perhaps media, making sure we don't overload on some of those negative experiences. Problem solve approach, taking action where you can have some control over it, get adequate rest and sleep, and support when, of course, seek support when needed. So the 5 ways, I'm not going to go through PERMA. You can look it up if you don't know what PERMA stands for, but there is a simple 5-way reminder on how to improve your mental health, and that is to connect, develop authentic relationships, be active, engage in some sort of physical activity, keep learning new things, and what a great opportunity during the demands that the COVID has created for us, and be aware, be mindful of things that are around you. So this is focus on mindfulness, and help others, do something for others. Now, there is lots of realizing my time is now up. So there's lots of resources that you'll see. And one of the ones that I really wanted to call out is the Work Well Toolkit, a great place that has been designed especially with this in mind for you to look at some of the resources and sign up and do a sort of step-by-step process for creating a mentally healthy workplace. I hope that you will start the conversation or continue the conversation and make sure that you create a place that prevents harm to mental health of our staff, promote the positive aspects, and ensure that people with mental health, ill health, are supported.
Thank you, Richard. That was fantastic, and loved the video in the middle as well. And to provide all these tools to those that are online is fantastic. And obviously, we'll provide those after the session. But we've got some fantastic questions in the Q&A and in the chat, and lots of great comments thanking you for your great presentation. So I thought I might just work through a couple of the questions, if that's okay, because we do have some time. So Linda Coogan, the staff who are having to adjust what they can do in their roles due to COVID-19 impacts, there's lots of tensions around the high work ethic and standards for themselves and their current capacity with COVID impacts. Staff are committed to achieving tasks and outcomes that's not as possible and can be really hard on themselves. How can we best support them? You did give some strategies, but this is really about we can be our own worst enemies. We push ourselves when really near enough is good enough. Can you talk through some of that for us?
Certainly, it's so true that some of our thinking can be self-defeating. You know, rather than being self-supporting, we are self-defeating. So it's and therefore connecting with others, with those genuine, supportive people that we have around us, could be so useful in reminding ourselves that we are actually doing better than we think in comparison to other situations, and particularly in this difficult context. So I think that's probably one of the most obvious thing is to find someone who's a friend, because you would normally be more supportive of others than you are of yourself. So having others remind you of that is kind of probably the place I would go to straight away.
Yeah, that's fantastic. Some other questions in here. Hi, Richard. And look, and I have to say, the comments in the chat are incredibly affirming and positive about this session, Richard. So I just want to, and we will save the chat so we can send it to you, and lots of sharing lots of tips and tricks that organisations are using. You know, I have a CEO directive of no meetings planned for 12 to 1 p.m. every day, while strongly encouraged to practice self-care. Anglicare have also offered an extra annual leave day. So lots of really fabulous, what I would call pragmatic and practical solutions in the chat that people have been able to share during this session. But another question, Richard, I've seen research that talks about the deficits in data collection to show how some workplace risks occur, e.g. low impact, high frequency violence and abuse from clients not being reported officially. This can speak to a culture of workplace risks being part of the job for caseworkers, etc. Do you have any insights on how we can improve the response to this kind of impact on worker mental health? So this is sort of the cultural aspects that you talk to. How can we change this sort of notion that it's okay and you should accept a level of, say, perhaps workplace violence?
Yeah, and this is what I was referring to before. It is such a a prevalent issue in our healthcare workplaces. So changing the culture always starts with leadership commitment. It can work bottom up, but really it's most effective when it's top down.
That's right.
So I think what I was suggesting before about getting support and kind of coalition of those who are willing to listen, I think I'd probably start there. And it could be providing data about how some of these situations impact on staff, and situations from around the world. There are many other organizations that grapple with the same issue. And there are actually very specific tools out there that, for example, safe wards. I'm not sure if you've come across it, but you might Google that. And there is a very specific program that is supported by the Victorian government, in fact, at the moment, to create a change in our organisation, starting with training. But it starts actually with a group of people who are willing to bring that across, implement it across the organisation. But it's always supported by someone in leadership who will say, yes, it's important, therefore I will speak to it, I will continue to raise awareness, and most importantly, when there are reports of aggression and violence, that we don't take them lightly, that we don't dismiss them, but thank people for reporting them. And every time there is a report of it, there is an opportunity for me to shift that culture to say, it's not accepted here. So it's, let's face it, our culture often is kind of a sum of all the little conversations that take place. And if those conversations can be started, wherever they can be started, but then from top down to be promoted on an ongoing basis, that's how we can change culture.
That's right, Richard. And as you're probably aware, at the centres working with WorkSafe and DFFH on a safety leadership modules around occupational violence in residential care. So we absolutely are learning and developing literacy in this space. Our agencies are, obviously doing some great stuff in this space. So this is an interesting one from Celeste. From your experience, Richard, what are some of the blind spots, easily missed areas you often see in organisations when they, we're all very keen when we're trying to support mental health? What would be the couple of things that you think always, they are the things that are their blind spots?
Well, I think probably the obvious one that comes to mind is that we shift our mind. When we talk about mental health, we think of individual support, and we think of do we have EAP? You probably have noticed that I actually haven't used the word EAP once in this presentation, because it has been used so much as if mental health or mentally healthy workplace was just limited to making sure that pink part is done, that one strategy is done. But that could, and also the fact that we are perhaps doing a lot in terms of mental health awareness. And that's another blind spot, that we could be thinking that we're doing so well because we have got these specific days, that we are promoting mental health on Are You OK Day or some other mental health day or psychology day. But mental health is, of course, 365, 24/7. Right, every day. So actually focusing more on and checking whether or not our organisations are mentally healthy should actually ask the question, are we preventing harm systemically at the source? And I think that's, what I mean, we could possibly have
early intervention, but getting in early.
And getting in early, but so we could have great days of, great promotion of wonderful lifestyle changes and so on at an individual level, and therefore be blinded to the fact that we are not actually doing things at the prevention end.
So this is an interesting one. So Nolata, do we need a mental health policy procedure, or can this be embedded in our existing occupational health and safety policy procedure? That is a great question.
That is a great question indeed. And when I was talking about prioritising mental health, I was actually thinking of integrating it within business as usual. It's a great one to discuss. I'd love to hear others' thoughts about this as well. But first of all, physical health and safety needs to be integrated with mental health and safety. So that integration of health and safety, absolutely. It's managed by one act, Health and Safety Act, and therefore we need to integrate those. But beyond that, I don't believe that we need we need sort of mental health and well-being kind of policies and processes that are separate from business as usual. So how do we make sure we create great client outcomes, safety outcomes for our clients? We can't do that without mentioning that we actually need mental health protected by our staff, checking how well we're doing and how work is impacting on us delivering these outcomes. So I would rather see it embedded. That would be my
fantastic.
go-to
Fantastic.
kind of,
it's interesting because there's a comment here from Anne. Unfortunately, the reporting of abuse, etc., in healthcare can involve a 30-minute report to fill out. While this is being done, who covers the work of those that we're asking to fill these reports in? And it does put then the stress on those that are reporting. And I think that it's a very good example of it. We mean well, but when we set up systems that actually make it difficult to report, then that's something that we really need to think about. Do you want to make a comment there, Richard?
Absolutely. And this is exactly where participation and consultation is so important. If we can have these great policies that say, we are doing something about aggression and violence, but unless we talk to people who are on the ground, who are giving us this feedback, we can't make changes. So we need to hear from them. We need to have these systems of reporting back to us how well some of those controls are working. In this case, it seems to me that we might have put in a great risk control, a few years ago. We thought, right, let's have this great reporting, system. But if we revised that, if we reviewed how effective this risk control is, we might find it actually has got unintended consequences. People are not reporting because the system has been put in place in such a way. So I think it would lead to some changes. Additionally, if we are serious about the sort of aggression prevention culture, we could be saying, well, for that part, we will make sure you are backfilled if we have these resources. The idea would say you take time. First of all, you need to have some sort of time to re-energize yourself and make sure you're okay yourself. So you need that downtime as well. You report. You may perhaps take it, but I realise it might be idealistic because there are perhaps not many places that can have this luxury of resourcing.
Now, I know we're not getting through all the questions, but I think there's some questions in here that you might be able to quickly help people. There's questions here on return to work, and Richard Snook, who's asked the question, we've run a number of these forums on return to work, so that might remind we might need to run another one. And both Matthew and Marinda are talking about resources. So does anyone have any links or resources on training in trauma-informed practice and support? So this is for those staff members who there is a mental illness or there is some wellbeing issues, and that really the way we work with those individuals, and in fact with lots of us, but let's look at the time we're in, does need to be trauma-informed. So obviously Matthew's looking for some resources there. And also Marinda is saying, does anybody have some resources on supporting staff with working together and easing some of those conflicts that can occur as we're all different and working differently? So wondering, Richard, maybe we could get you to refer us to some resources in terms of those suggestions.
I wish I could very quickly kind of flick some forward, but I am pretty sure that in my slide pack there are enough websites here that deal with trauma and trauma-informed practice, but there is also plenty of others that are embedded in those resources. So, for example, the WorkWell toolkit has got a tremendous number of documents and other links that I'm sure deal with the trauma itself. Now, as far as working together and dealing with conflicts, it's an ongoing issue, right? Wherever people are, there's going to be conflict. So I'd like to sort of see some ongoing positive conflict resolution training that involves civility as its most important aspect of it, that inoculate people against negative conflict. So making sure that we are okay about disagreeing with each other and being passionate about the way we, perhaps have a different idea about how to help clients, but never cross the line to the personal in civil conversations.
Yeah, I think you raised that consistently during your presentation, which covers off, in many ways, it's sort of the base and the fundamentals of the way we engage with each other in good times and in bad. And we probably need more of that stability now than we've ever needed before, Richard, because they're very tense times. Now, look, we will collect up all of this material, and if there are resources or references that you're looking for, we will work with Richard to make sure that we can point you in the right direction in terms of the material that's in those slides. I just want to say thank you to Richard for his time. It's been amazing having you here today. The affirmations in the chat are wonderful, and it's really always heartens me to think that this has been timely and useful for my colleagues who are working in the field. It is really tough. It is an incredibly tough time with waves of anxiety being felt within the Victorian community as a consequence of the pandemic. And we also know that the work that you all do is difficult enough. We will keep bringing these sorts of webinars to you to assist you in any way we can. It's good to hear that you felt that Richard's presentation was pragmatic and practical and gave you ideas that you can take into your workplace, because that's really what we're about. So if we can give Richard a virtual clap and thank him for his time today, and we'll get the material from this session out to you as soon as we can. Thank you so much, everybody, for being here today. Thank you, Richard, and thank you to Jo from WorkSafe for being with us as well. This has been a phenomenal webinar and very timely.